here. Welcome to everyone. It's great to see so many faces on the screen, and we're so glad you could join us. I'm Lindsay White. I'm with the Leukemia Research Foundation, and Leukemia Research Foundation is very grateful for our partnership with Cancer Wellness Center in producing this event on mindfulness in cancer care. I'm the Director of Programs and Partnerships at Leukemia Research Foundation. I'm going to talk just briefly about our organization, and then I'll hand it over to Savina, who can do the same as well, about Cancer Wellness Center. So Leukemia Research Foundation's mission is to cure leukemia by funding innovative research and supporting patients and families. The foundation has raised over $90 million in support of its mission since our founding in 1946. And we have funded research grants to over 700 investigators worldwide during that time. Our support for programs for leukemia patients and their loved ones, include information and resources on our website, education programs like today's, financial assistance, and we provide lots of resources on our website, directory of other helpful organizations, and lots of helpful information about the diseases, etc. So we welcome you all to explore a little on our website when you have a moment, and Savina is going to talk about how you can do that and talk about her organization next. So Savina, please.
Thank you so much, Lindsay, and thank you for everyone for being here today. We're grateful for a continued partnership with the Leukemia Research Foundation. My name is Savina Chacheva. I'm the Program Director at the Cancer Wellness Center. I'm really glad you could join us. For those of you who are joining and learning about the center for the first time, I would like to share more about the center and the services that we offer. The center was founded in 1989 as a nonprofit organization with the mission to help anyone touched by cancer find a way forward. Each year, our free counseling services, support groups, health and nutrition programs serve over 1,800 community members of all ages and backgrounds. People with cancer, family members, friends, and caregivers all come to us to connect and cope. Our services, which are both virtual and in person, include education programs like the one today that aim to help you navigate the varied challenges that come with living with a cancer diagnosis. Wellness classes like yoga, meditation, nutrition, and more that provide a holistic approach to healthy living. And support services, including counseling for individuals, families, couples, children, and those bereaved, as well as support groups that are designed to help our participants manage the emotional and mental impact of cancer. To learn more about the center and our free programs and services, as well as Leukemia Research Foundation services, please visit our websites. And the links will be included in the chat. A few housekeeping items before I introduce our speaker today. Please don't be shy. Ask questions. Use the chat throughout the session. Questions will be addressed at the very end to make sure that we get to everybody. Please note that your audio is disabled for this program as we're recording it for future viewing. Lastly, please note that you will receive a program evaluation after we're finished today, and we hope you take a couple of minutes to complete it and provide your feedback. Now, without further ado, we're grateful to have Serena Jain with us today. Serena Jain is a qualified mindfulness-based stress reduction teacher who received her training through the University of California, San Diego Center for Mindfulness. She's also a board-certified integrative health and wellness coach through the Duke Integrative Health and National Board for Health and Wellness Coaching, and she holds a BA in Communications from North Carolina State University. Additionally, she's completed trauma-sensitive training in mindfulness and meditation at the Oxford Center for Mindfulness. She comes with a lot of experience and is here to provide you with the tools to help you cope with cancer today. Thank you so much for being here, Serena. Welcome.
Thank you, Savina, and thank you, Lindsay. Thank you to the Leukemia Research Foundation and, of course, Cancer Wellness Center for giving me this opportunity to share the power of mindfulness in cancer care today. I just want to share that I am with the Cancer Wellness Center for over a year now as their mindfulness specialist and have been working with cancer patients both in treatment and beyond and pre and post for a while now. And it's been wonderful and remarkable journey. And I'm very, very excited to be here with all of you today to share not only what the research says, but what I have learned as well, working with cancer patients. So without further ado, I'm going to open a slide deck for all of us to look at during this presentation. So Savina and Lindsay, just bear with me for a moment. And I want to put this on, oops, okay, so can everybody see that? Can you just give me a thumbs up if you can see my deck? Yep, okay, great. So today we're going to talk about, mindfulness. Well, what is it actually? What does it mean to be mindful? What are the benefits of mindfulness? What are some common emotions that come up with the cancer diagnosis? And we're going to talk about how mindfulness can be used as a complementary and therapeutic tool when dealing with the stress of a cancer diagnosis. We're also going to talk about how mindfulness can help us with choice, to make choices and understand that we have choices. We're going to talk about how to employ mindful communications in our health and health advocacy. And then we're also going to learn how mindfulness can help us become our own health advocates. We're going to actually do a mindfulness exercise as well, and we'll have time for some Q&A and learning further about mindfulness programs and practices, and then we will come to close. So I'm going to go ahead and get started. We have a robust agenda for today. So what is mindfulness? There's this, this buzzword that we all hear about all the time these days, and I want to just make sure we all understand what it actually means. So mindfulness is the awareness that arises when we pay attention on purpose in the present moment in a non-judgmental attitude. And so what that means is bringing a gentle and accepting attitude to our present moment, whatever it is, and accepting our present moment, whatever it is, with kindness and curiosity in a non-judgmental way, both internally and externally, because moments happen outside us and they also happen inside us. So being able to become aware of what's going on both inside us and outside us. The non-judgmental piece of this definition is also really important, because what that means is that mindfulness also really involves cultivating acceptance. Acceptance meaning that we pay attention to our thoughts, our feelings, and rather than trying to run away from them or discard them or judge them, we allow them to be as they are without getting too entrenched in them and running their course. So when we practice mindfulness, what we're doing is we're tuning into our thoughts through our senses, through our sense doorways, and we're learning to relate to through our sense doorways to the present moment, rather than worrying about the future that hasn't happened yet or imagining the past. So it's important for us to learn about what mindfulness, of course, but what is the opposite? What is mindfulness not? So what is the opposite of being mindful? Now, the opposite of being mindful is being on autopilot. When we live our lives on autopilot, we oftentimes end up reacting to situations that arise for us that we may not want to, just because we're on autopilot or we're not so self-aware. We become reactive because we're not so self-aware. So when we're on autopilot, these are some things that can happen. How many of you have ever said something that you wished you could take back? And I can't see a show of hands, but usually I ask people to raise their hands. How many of you have ever done something that you later regret? Or you notice that your mind is thinking about something over and over and it won't stop. You can't fall asleep because your mind is spinning and your body feels restless. And lastly, how many of you have had trouble focusing or you're spacing out? So what happens when we're on autopilot, all those things happen, but what mindfulness does is that it comes in and it takes us off of this autopilot way of being. Mindfulness is a way of quieting our minds, paying attention to what is actually true in the moment, and also building that self-awareness, cultivating that self-awareness to know that we are in fact going off onto autopilot and we need to take ourselves off of it. So mindfulness is the opposite of autopilot. So why should we practice mindfulness? The research shows there's so many reasons, and here are some of the reasons to practice mindfulness. And this is what the research has told us, that mindfulness helps us with stress, helps us with anxiety, depression. It can help with pain. It can help with fatigue. It can help us facilitate our recovery when we're sick or if some body part is injured. It helps us sleep better. It helps us with our mental health. It helps us to regulate our emotions. It has a positive impact on our brain and our immune system. It gives us enhances our ability to deal with illnesses. It's proven to lower our blood pressure, lower our heart rate. When we practice mindfulness, we learn to build our body awareness. We become more aware of our body, and we can also become more loving and in that awareness of our body. It helps us to perform better. So if you're performing in any way, it helps you to perform better. It increases your effectiveness both at work and school. It helps with relationship issues. It enhances our resilience to life and everything that, life throws at us. And it just improves our overall well-being. So there's so many tremendous reasons out there on why mindfulness is beneficial. Now, with cancer, when we're dealing with cancer, a cancer diagnosis affects our physical, mental, and emotional health. A diagnosis can bring up a huge and wide range of emotions that we're not probably too used to dealing with. And these emotions can be experienced by everyone involved with the diagnosis, the patient, the caregivers, family, friends, anyone involved. So these are some of those common emotions that we experience when we're dealing with cancer diagnosis. So the first one, shock and denial. When we first find out about cancer, we might feel a tremendous sense of shock. We can feel numb, disbelief in what is happening. It can be difficult for us to express emotions. We may also feel a sense of denial, not wanting to know about the cancer, preferring to talk about it as little as possible. We can also, when we first learn, we can also feel a sense of overwhelm. It's also normal to feel as if our lives are out of control. And that could be because our normal routine is completely disrupted by the doctor visits, the treatments. People are using medical terms that we don't understand. It's hard to enjoy the things that you normally do enjoy. And oftentimes it's helpless and lonely. We feel helpless. We also feel fear and worry. It's scary for us to know that we have cancer. We can be afraid and worried about, the pain that's going to be associated with the treatments, feeling sick, looking different, taking care of our families, paying bills, our jobs. There's so much fear and worry. And then stress and anxiety occur during that, both during and after treatment even. It's normal for us to have stress over all those changes that we're going through. Many people will get confused and stressed over things like, insurance, and whether it'll cover tests and treatments. Where can we find emotional support? How can we get help with daily routines? How will cancer affect, our entire life with work and everything else? And simple things like, transportation to appointments. There's so much that goes along with it. Anxiety happens when we have that extra worry, when we can't relax, when we feel tense. We may notice that there's a rapid heartbeat. We have unexplained body pains or muscle aches, headaches. We don't feel like eating, or we eat too much. We can feel sick to our stomach. We can feel shaky, weak, dizzy, have a tight feeling in the throat and chest. We can want to sleep too much or sleep too little, find it hard to concentrate. So anxiety happens when we're constantly worried about a future that is unknown. And then we can have guilt. We can have blame and anger. We can feel guilty that, that we feel this way. We can feel guilty that many things are happening that are out of control. We can blame others, and ourselves for upsetting people that we love with this diagnosis. We can think that we're a burden in some way. We can feel blame about having to miss work or, just complete upside down in our lives. We can also feel, envy about other people and their good health and feel ashamed of that. We can make lifestyle choices, feel upset about lifestyle choices that we made that may have led to the cancer. So there's a lot of emotionality around it. And you might even blame yourself for the illness. But understanding more about your cancer can help you feel differently. And then lastly, you can feel angry. You can feel angry at people close to you, at doctors and nurses. You can feel angry at your spiritual, practice. If you're religious in any way, you can feel angry at people who are not having to deal with cancer. And then sadness, of course, can happen. Many people with cancer feel sad. They feel a sense of loss of their health, of how life was before and how life is now. Even when you're done with treatment, you can still feel sad. It's a common response to this illness. And then depression. So when we're sad, we have little energy, we feel tired, we may not want to eat. For some, these feelings go away, they lessen over time, but for some, they can become stronger. And then lastly, we can feel lonely. People with with the diagnosis can often feel lonely or distant from others. And that can be for a number of reasons. Sometimes our friends have a hard time dealing with the cancer. We might feel like alone in our ability to cope with it. We may not feel supported. We may feel too sick to take part in hobbies and activities that we used to enjoy. We may not feel like reaching out to people, and we may not feel like anyone understands what we're going through. So there's a lot of emotions that come with cancer, and many of those are emotions we're not used to dealing with. So how does mindfulness come in and help with all of this? So what mindfulness is it's a complementary and therapeutic tool for cancer stress. And how does it do that? So with mindfulness techniques, we can create better outcomes for ourselves and for all of those affected with the diagnosis. And it does that by helping us to cultivate that present moment awareness, the ability for us to stay focused in the present moment rather than thinking about the future that's unknown or reliving the past. It's natural for us to have stress, anxiety with a cancer diagnosis, with the worrying about the future and the unknowns, the uncertainty of the diagnosis, of course. So mindfulness, what it does, it helps us to steer away from that. It helps us to steer away from that sense of that worry of the unknown that cancer brings by cultivating that strong ability to stay in the present moment. So when we practice mindfulness, we can experience those calming effects it has on our mind and on our body. And the research also shows that when we practice mindfulness, we can experience that improvement of our mood, psychological well-being. We can experience an increase in positive emotions also. Mindfulness practice also helps us with reigniting a sense of hope during our stressful days. By helping us focus on the here and the now, it can help us bring hope into everyday life rather than, again, worrying about a future that is uncertain and unknown or rehashing the past. Now, when we practice mindfulness, it also helps us with physical pain, to mitigate those physical symptoms of cancer and the fatigue that is often associated with cancer. The exercises help us to build body awareness and cope with the tension and the discomfort that comes in that non-judgmental manner. The exercises help us to expand that awareness of everything that we're doing and also helps us to provide a sense of peace. Mindfulness is actually recommended for patients along with the medicinal interventions, transplants, and other treatments they may receive that have been shown to be equally, if not more effective in managing the fatigue that comes with leukemia management. So it's very helpful in that, in mitigating those symptoms of physical symptoms of pain and fatigue. And then lastly, mindfulness helps build our self-awareness. When we're self-aware, we can catch ourselves before we get triggered. We can catch ourselves before we go into that flight, fight, or freeze response, which helps us to decrease our reactivity in stressful moments and be able to understand that we have choice rather than reacting in the moment. So mindfulness and choice. Mindfulness practice assists us with understanding that we can make choices. We actually have choices rather than feeling holed into something. Many decisions have to be made when you're dealing with cancer, right? Remaining mindful means that you're present, conscious of your thoughts, feelings, emotions, body sensations, and your surrounding environment. And that gives you that sense of that heightened awareness. And when you have a heightened awareness, it allows you to make a decision process more thoughtfully. It becomes a cognitive exercise rather than that impulsive knee-jerk reaction to our immediate needs. So it helps you zone out and look at the big picture. It helps you zoom out and look at the big picture rather than focusing on your immediate knee-jerk reaction to your immediate needs. It also gives you this ability to problem solve more creatively. Because when you are aware of choices and understand that you have choices and you're able to zoom out, look at the big picture, you have the ability to problem solve more easily. Mindfulness improves the ability to recognize the limits of our own knowledge. So if we are mindful and we understand that we may not know something, and we may not understand something, it helps us to understand that it's okay and that we need to ask for help. So it gives us that ability to understand that we don't know, to know that we don't know, but also to be able to articulate that we don't know and also be able to ask for help. It improves our ability to weigh pros and cons and consequences of decisions. When we are mindful, of course, we can zoom out. We can understand the problems. We can understand, the implications, and have the ability to sort of weigh out the pros and the cons and understand the consequences of decisions rather than jumping to reacting in the moment. We can choose to respond in ways that are more thoughtful. And then lastly, mindfulness gives us space for decision-making and understanding of choices. When we practice mindfulness, what we are doing is we are creating space. We're creating space in the mind, creating space in the body, creating space in our lives to be able to calm down in the moment, understand what we're doing and where we're at, rather than jumping into that reactivity. So we're creating space, and when we have space, we can make decisions and understand our choices more easily and in a less reactive sort of way. So mindful communications. So mindful communications is really useful when we're dealing with a cancer diagnosis and in life in general. Mindful communications means that we're applying those principles of mindfulness that we're learning to the way that we correspond and relate with others. So the first thing we'll do is we'll set intentions. We'll set intentions of how we want the communications to go. For example, we want the communications to be calm. We want them to be, understanding rather than, coming into conflict or reactivity right away. We can set intentions. We can use active listening, which is a proponent of mindful communication. So when we're listening to someone, we give them our full attention without interrupting, without planning our response, but we're really listening, true listening, active listening. It means we're really listening, we're hearing, and not just formulating our own response. When we are in mindful communications, we're employing a non-judgmental and open attitude. So what we're doing is we're approaching conversations with an open mind. We're avoiding those immediate judgments or assumptions about what another person is saying or what they're thinking or what they're feeling. When we are using mindful communications, we're building our empathy. So we're trying to understand and share the feelings of the other person, which helps us to build a deeper connection and foster a more compassionate interaction with the other person. It helps us with our emotional awareness. We become more aware of our own emotions and how they might influence our communication and manage them effectively to avoid letting them derail the conversation, to avoid letting our emotions sort of hijack that conversation and become more aware of them rather than letting them, control the interaction. We'll also have the ability to understand verbal cues, nonverbal cues. So we'll be able to understand body language. We'll be able to understand tone of voice, facial expressions, both ours and the other person's, to ensure that our message is being conveyed accurately and with respect. Clarity and honesty. So communicating our thoughts and feelings clearly and honestly, while also being considerate of how our words can affect others. And so when we practice mindful communications, we can improve relationships. We can more easily come to resolve conflicts, and we can be more positive, respectful in the exchange of ideas. And so when we practice mindful communications, it really helps us to become a health advocate in our own cancer care. Because what we're doing is we're taking back our power. When we practice mindful communications, we are taking back our power, taking back our ability to do all of these things, to be able to become our own advocate in our cancer care. So mindfulness and health advocacy. With cancer, of course, there's busy schedules, there's distractions, our bodies are going through a lot. And with mindfulness, we want to be able to cultivate that health advocacy. We want to be able to become our own advocates. And when all of those things are happening, it becomes difficult for us to pay attention to our bodies. But when we listen and pay attention to that fatigue that's happening, that discomfort, our mood changes, all those things, and that we recognize that we need to rest. We recognize we need to adjust our diet. We acknowledge that we're feeling, isolated or tired or lonely or all those things that can happen. It's important for us to build body awareness because our bodies possess an innate wisdom. And, when we cultivate mindfulness, what we're doing is we're building our body awareness, and we're learning to drop in from our cognitive brain into our bodies to be able to learn how to listen to our bodies and understand that innate wisdom that they have. It's a silent language that conveys insight about our physical and mental well-being. And when we ignore the signals that our body's sending to us, that can lead us to a more serious, burnout and health issues as well. So that listening into your body and understanding what it's trying to communicate with you is very important. And that happens when you practice mindfulness. You cultivate the awareness, and you also learn to listen to your body. And when you become an advocate, what that means is that you're actively participating in your health and well-being. It involves seeking information. It involves asking questions, aligning choices that you make with your own values. And the world of healthcare is complex. It's important to have self-advocacy to navigate that path forward in the cancer care journey. So being able to discuss treatment options, make lifestyle choices and changes empowers you to take that active participation. And so how can we do those things? By incorporating those mindfulness techniques like meditation, like yoga, we can learn to connect with our body's signals. Through those regular self-check-ins, you can assess your physical and mental and emotional well-being, and you can become educated about how you're feeling and what you need. You can also educate yourself. You can stay informed about your health and any existing conditions that are happening to be able to have more meaningful conversations with healthcare providers. The mindful communication is a piece of this as well, because it'll help you foster that open communication with your healthcare team. You'll be able to share your concerns and questions and preferences, and you'll be able to set boundaries. So you'll be able to understand that you need to say no when you need to say no, and prioritize your own health and well-being to be able to prevent further burnout. So mindfulness really gives you that empowerment and that understanding and that ability, that choice to be able to become your own health advocate. And when you do that, you can embrace your inner advocate. When you start to practice mindfulness, you can learn to trust yourself, trust your body's innate and inner wisdom, and be able to embrace your inner advocate. Learning to listen to your body is an ongoing journey. And being your own advocate is a powerful commitment in self-care. By embracing these practices, you embark on that path of self-discovery, resilience, and empowerment. Remember that your body, it speaks in a unique language, and all we need to do is learn how to drop in and listen. So I've spoken a lot today, and I'm going to lead you now into a mindfulness exercise. And the exercise is called belly breathing. So belly breathing is a meditation practice where we're going to intentionally bring awareness to our breath at our bellies. And belly breathing, it helps with anxiety. It helps to make us feel better in our mood. It increases oxygen to our body. It decreases our heart rate and blood pressure, and it stimulates the immune system. So we're going to go into this practice right now. And for this practice, I'm going to stop the screen share, and I'm going to guide you through this practice. So let me just stop the share. Okay. Okay. So we're going to do this practice now. And if you like, you can put your cameras on. The invitation is, of course, if you like to, you don't have to. It's totally optional. So again, going into a belly breathing practice. So I'll invite you to get started by getting yourself into a comfortable position. So that could be seated, it could be lying down, whatever works for you right now. Just taking a moment to notice and listen in to what your body would like to do. What does your body need right now? And as you come into a position that will support you for this practice, we'll begin by placing one hand on our chest and one hand on the belly. I'm going to lower my camera so you can see. One hand on the chest and one hand on the belly. So on your belly. And then when you're ready, the invitation is to close the eye, if it's okay for you. So close the eyes, or you can lower your gaze to the ground beneath you. And then as you arrive into this position, start to notice the breath going in and out. So don't try to change it at all in any way, but just begin to notice it, become aware of your breath going in and out at the chest and at the belly. And now notice where you can feel your breath more. So start to identify, where can you feel your breath more? Do you feel it in the hand that's on your chest? Or in the hand that's on your belly? So just notice, where do you feel your breath more? And now see if you can take the awareness, your attention, and as you breathe in, see if you can inflate your belly more than your chest. So as you breathe in, we're going to expand the belly like a balloon. And then as you breathe out, watch your belly contract all the way back down. So breathing in, expanding the belly more than the chest. And then breathing out, the belly contracts back to the spine. Breathing in, expanding the belly. And breathing out, the belly contracts. So we're taking deep diaphragmatic breaths in the belly, focusing all of our breath from our chest down into the belly. Breathing in and expanding the belly like a big red balloon. Breathing out, contracting the belly. So we've been taught in our lives that we're supposed to bring our bellies in. We're supposed to suck them in when we stand up straight. But when we are in meditation, we want to have a soft belly. So just keep breathing in this way. Breathing in, expanding the belly. And breathing out, contracting the belly. If you think about it, if you've ever seen a baby breathe, you want to have a soft belly just like a baby. When they breathe, their whole belly expands. So on the in-breath, expand the belly. And on the out-breath, feel the belly contract. Allow the breath to go all the way in and all the way out. And then on the next in-breath, see if you can count to 3 on the inhale. So inhaling, expanding the belly for 3 counts. And then on the exhale, allowing the belly to contract for 6 counts. So inhaling and expanding the belly for 3 counts. Exhaling, the belly contracts for 6 counts. Breathing in for 3, expanding. Breathing out for 6 and contracting. So keep on breathing in that way. And as you do that, you might notice thoughts like, am I doing this right? Well, this feels awkward or different. And see if you can just notice those thoughts and then bring your attention back to your breath at the belly. Say bye-bye thoughts, not now, and just bring your attention back to the belly. And just really focus, bring the awareness on in for 3, expanding. And then out for 6, contracting the belly. So here we're using our breath as an anchor into the present moment. Our minds were made to think, that's what they do, that's a wonderful thing, but for our concentration to increase and for us to be able to calm ourselves, we have to be able to focus where we decide we want to focus. So in this case, we are focusing our breath on the belly. In for 3. And out for 6. So you might want to picture a ship as you continue this breathing. Picture a ship in your mind's eye. It would have an anchor out in the water. And it might move with a bit from side to side with the wind, just like your mind may have a thought, but ultimately it stays put. So your breath is the anchor. It can bring you back to this moment over and over. In for 3, expanding the belly. And then out for 6 as the belly contracts. So we'll take a couple more breaths as we come to the end of this practice. Together. In for 3, expanding the belly. And out for 6 as the belly contracts. We're going to wrap it up, taking your last breath in this way. In for 3 and out for 6. And then as you come to the end of that breath, allow your hands to drop into your lap or down by your sides. And just before you open your eyes, I'd ask you to take a quick check-in of your mind, of your body. And just notice what is here for you right now. How is the mind? How is the body? Take a moment to notice and allow yourself to experience whatever you're experiencing in this moment. And then whenever you're ready, you can just come to gently open the eyes and returning to our presentation. So that was a belly breathing exercise, which is a wonderful way to begin a mindfulness practice. I'm going to open up. If you'd like to turn your videos on, that would be great. If you're capable of doing that, if you're able to, that would be wonderful. I'm going to open up the slideshow again. And we'll continue. Let's go through these slides. So again, that was belly breathing. And when we practice belly breathing again, what we're doing is we're bringing our awareness and our focus to our breath at the belly. And every time we notice that our mind travels away, we bring it back to the belly. Just like that ship has an anchor that keeps it centered in the water. That's what you're using your breath to do here in this practice. Again, it helps with anxiety. It helps with our mood. We can come into a more positive mood after practicing that. It helps to increase oxygen to our body. It helps to decrease our heart rate, our blood pressure, and it stimulates the immune system. So as you think about mindfulness and mindfulness programming, there's a lot of mindfulness programming available out there, especially in cancer settings, in oncology settings. Those programs are usually presented as a mindfulness-based stress reduction program, mindfulness-based cancer recovery, and those things all of these programs are typically called mindfulness-based interventions. You can find them at hospitals, cancer centers, community centers, spiritual centers, gyms, yoga studios, meditation centers, all sorts of places like that. And I like to recommend for everyone out there who's interested in taking a mindfulness program to please begin with a live class. It can be virtual or it can be in person, but please begin with a live class. So not using an app, but rather a class with a certified teacher. So taking a class with a certified teacher is very important because these are very specific trained teachers who understand all the different components of mindfulness. And it's important for you to find a class that is with a certified teacher. Now that live class option, it allows for you to have this group experience. For example, you're going to be in a group probably, and you're going to understand that when you're in these groups, there's a sharing component. And when people share what they're why they're here or what they're struggling with, you understand that you're not alone in your struggles. So there's a sense of common humanity that, hey, we're all here together. Everybody's got, something or the other, and we're all in this together. So it gives us this sense of understanding that we're not alone in our struggles. There's also that didactic learning piece where you're going to be learning about the foundations of mindfulness, why certain practices are useful and why others, may be better for you at certain times. So it's really useful to learn not only the practices, but the intention of the practices and why you're doing them. There's also this, of course, when you're in a group, there's the idea of community support and validation, which will not only keep you coming back, week after week, but also it'll give you a sense of accountability that you're a part of this group, you've signed up, and you're going to come and you're going to show up. And again, always to do these classes with a certified teacher. In the classes, you're going to be learning a variety of a variety of practices. And you'll be able to create a toolbox, a mindfulness toolbox of practices. For example, we just learned belly breathing, but there's so many other practices out there. There's a huge variety of them. And so it's really great to be able to say, you know what, today I need to practice this way because that's what will be most supportive for me right now. Or right now, as I'm falling asleep, I need to do a body scan because that's what I need to do to be able to fall asleep. And I like to end with mindfulness is dose dependent. So the more you do it, the more benefits you will receive, the more accessible it will be as a resource for support. And these classes are helpful to help you, feel this type of support, to support you with this. So I'm going to go next into the practices. So as I said, there's so many practices out there, and we only have just done belly breathing. Here is a whole list of many more practices, and this is just a small list of the many practices that are out there that you will be learning in the programs and classes you sign up for if you choose to sign up for mindfulness programs. These are just some of the practices that you can learn to create that toolbox to be able to practice mindfulness. And remember that mindfulness does not need to be practiced only when you're sitting on a meditation cushion. It can be practiced when you're washing your hands. It can be practiced when you're taking a shower. It can be practiced when you're at the hospital. And it can be practiced, throughout your daily life, both. So there's a sense of a formal practice where you're sitting on a meditation cushion, and there's a sense of informal mindfulness where you're bringing the attitudes of mindfulness into your daily life. And so you'll learn all of that in those live classes with the certified and trained teacher. And I believe that is all for me for now. And I'd love to open it up for a Q&A if anybody has any questions.
Great. That was very, very helpful, informative. I thought it was great to do that belly breathing exercise. Thank you so much for that. And I want to remind everyone that you are welcome to enter a question in the chat. And when we see the questions, we will pose them to Serena, and she can address them. And in the meantime, I just wanted to say one thing that just was an observation of mine as I was contemplating the many different people on this webinar live today. I think everyone brings very different experiences with their health to this webinar. As I think about from the leukemia perspective, we have some people who have acute diseases who are in active treatment, some people who have chronic diseases who have been in treatment for a long time or maybe in a watch and wait pattern, but have had a diagnosis for many years and have kind of that uncertainty that you mentioned that they're kind of working with. And then we also have many people probably on the call today who are post-treatment, maybe had a transplant. So I think that it's great that we have so many different perspectives here. So I look forward to the Q&A and to get some great feedback and questions and answers. So it looks like we've got a few here. Let's start with the first one. What is the difference between mindfulness and meditation?
Excellent question. Thank you for asking. So mindfulness is the awareness that arises when we pay attention on purpose in the present moment with that non-judgmental attitude. So that's what we're trying to cultivate, is the awareness, the present moment awareness. That's what mindfulness means. Meditation is a way for us to practice mindfulness, to cultivate mindfulness. Meditation practices are used for us to be able to cultivate that present moment awareness and bring it into our daily lives. I hope that answers your question.
What type is best for insomnia?
For what?
Insomnia.
Insomnia. It's a great question. A lot of people find many practices very useful for sleep. What I know for a fact is that a body scan and the belly breathing practice are very useful to help us fall asleep and to help us stay asleep, and also to use in the middle of the night when we wake up and we instead of, for example, going to watch TV or looking at your phone, go straight to the belly breathing, go straight to the practice. So we don't want to distract with technology in the middle of the night. We want to go straight to the practice. And belly breathing is very useful. Put your hand on your belly right away when you wake up, or if you're having trouble falling asleep, and do the practice to help yourself get back to sleep or stay asleep. Body scan, of course, was listed in the slide. That's another one that's very useful. In fact, when I was training to teach, the teacher who was training me to teach a body scan fell asleep while he was training me to teach the body scan. So that's another useful one.
Okay, I don't see any additional questions. I do see some thanks. So thank you for your gratitude. That's wonderful. And I also wanted to acknowledge when I was calling out the various perspectives on the webinar today, I did not mention the vital importance of caregivers, and I suspect we probably have a few caregivers on this webinar as well. And maybe if you want to talk a little bit about that particular role in cancer care, Serena, and how caregivers can share their kind of perspectives or how they are coping, maybe this in similar ways or different ways with the patients, so and other family members as well.
Yeah, I think it's vital for a caregiver in these situations to also lean on mindfulness as a tool for coping, because caregivers are experiencing, you know, a large amount of stress as well when helping and coping with cancer care. And so, you know, mindfulness again is a tool that we all can use to be able to cope with cancer care. So as a caregiver, you're sort of in charge of many things, and it can lead to, you know, to often feeling fatigued yourself and stressed yourself, of course, burn out yourself. So how can you take care of yourself so that you can take care of someone else, right? Putting on your life vest first so that you can help someone else. If you cannot swim, then how can you help someone who's not able to swim? So the whole idea of mindfulness practices is for us to be able to it is the most radical way to take care of ourselves, I would say. It is a wonderful and radical act of self-care and self-love. And so for a caregiver, you know, do all these practices just like the person experiencing, you know, the diagnosis, and maybe even together, maybe even taking the classes together, you know, because they're so important for you and for that person.
Great. Thank you so much for that. And we also had a question that was submitted during the registration, and I'm not sure if this individual is participating live or maybe watching the recording, but I think it's a great point, which comes back to something I mentioned earlier. In this case, this individual is in remission from AML and fearful that it's going to return, and feels a lot of anxiety about that. So I know that, you know, several of the practices that you mentioned can be kind of helpful in that. And I think also many of the individuals, as I mentioned, who have chronic cancers also live in fear that their disease will change and may become something that they, you know, have that has more of an interruption in their daily life than it currently does. So perhaps if you could just kind of talk a little bit about that uncertainty factor and how to manage that, maybe call out some specific practices.
Yeah, of course. I'm going to actually go back to the slide. So thanks for asking that, Lindsay. The whole idea of you know, the idea of recurrence of cancer is highly stressful and anxiety provoking. So I just want to name that is actually, you know, a reason to feel stressed and anxious, of course, because we're not sure of what's going to happen. The thing about mindfulness is that what we are doing when we're cultivating mindfulness, when we're becoming more present and present moment focused, is we're not in the future. And we're also not in the past. We're actually right here. Because if you think about it, right here is really the only place we can be. We don't know about tomorrow. We don't know about yesterday, or we can't even locate yesterday. Where did yesterday go? It's not where if you wanted to put your hands on yesterday, you can't. And even if you want to put your hands on tomorrow, you can't. So the only place we can really be at any moment in time is here. I know it's easy to say, but when you practice some of these practices, that's what or all of them, you're cultivating present moment awareness and the ability to be present and only deal with what is it that is happening now, right? Of course, we have to plan for the future and we have to think about the future. But when that future, brings us into anxiety and it becomes debilitating in a way where we can't function, then it becomes a problem, right? It becomes a problem. So I would say all of these practices help us to cultivate present moment awareness and to quell anxiety. So in particular, of course, that belly breathing practice and these awareness of breath meditations are very useful. I like to teach walking meditation and mindful eating because we're always eating in our lives. We have to eat, right? So eating is a part of our daily life. And when we learn how to eat mindfully, that's a really great way to reduce anxiety. It's actually proven to be able to reduce anxiety because what you're doing is you're bringing that awareness to eating. So you can slow down your mind, slow down your body. When we are anxious, our mind is racing, our body is racing, right? We're having a high heart rate, perspiration, all that, and our thoughts are racing. And when we slow down, when we insert space of any kind, that's when we can lower our anxiety and come into the present moment. So again, all these practices are useful for anxiety. The other thing about that is that bringing a sense of understanding and acceptance and compassion to that actual feeling of why is there anxiety? There is anxiety because yes, there is something that is very scary that's happening. So also giving yourself some self-compassion in that whole act of, yeah, we want to do the practices. We don't want to feel these symptoms, but why are we actually feeling them? Making some understanding with why we're feeling them and acceptance is important as well.
I agree, and I think you also talked a little bit in the beginning about incorporating mindfulness into your daily practice gives you a heightened awareness of where you are, right? Mm-hmm. And I think that incorporating mindful communications, as you were talking about, can be so vital for patients who are in these situations where they don't know what might happen. And when I think about conversations that I've had with patients, one of the best things that they can do is, not go into an interaction with their care provider, whether it's their hematology oncologist or another cancer specialist or somebody, and not be prepared. And I think that preparedness is vital in these situations so that people can feel empowered, right? If they prepare a list of questions ahead of time, maybe have some belly breathing in the waiting room before going into that conversation, all of these things. And also, of course, having a caregiver or someone who can go with them to kind of, help them through that conversation, keep track of what's been discussed.
Absolutely. Absolutely.
Okay. Well, we don't have any additional questions. If somebody wanted to throw one in the chat real quick, we can maybe sneak it in. But otherwise, we might just want to start wrapping things up. One question was asked if we can share the information that you've shared, whether it's the slides or the kind of list of resources. Would that be okay?
Yes, absolutely. I can send the deck over to you. I do have a closing slide. I do have some final points to leave. I'd love to leave everybody with, if that's okay.
Sounds good.
Okay. So I just like to, end with a few points here. Of course, cancer is, a life-changing and very, very stressful event. So I just want to note and name that is Very true. And when you practice mindfulness, it can become very supportive as you cope with your cancer, as you cope with cancer care. For those who are both the patient and, of course, the caregiver and anyone else affected. Because mindfulness helps us to cope with all those difficult emotions that we are not used to experiencing, all the physical symptoms that are related with cancer. Mindfulness helps us to cope with those. And it does that by helping us to create that present moment awareness. Because when we are present, we're not worrying about a future that we don't know what's going to happen. And when we are present, we're not thinking about the past. So mindfulness helps us to be present. Please, if you're going to take a class, take a live class with someone who is certified. Developing that toolbox of practices will help you. If you decide tomorrow morning, I want to do this practice because that's how I feel, or, tonight at night, in order to fall asleep, I'm going to do this. So again, knowing that you have so many different ways, there's not just one, but there's so many different types of practices out there is very useful, and you build your toolbox. So when you practice mindfulness in your cancer journey, it can bring you those moments of peace and balance. Moments of peace and balance. And that's what we're looking for here, is those moments, right? Just those moments, which will help us feel that sense of peace, that sense of balance. And then I'm sorry. Uh-oh, what happened to the slide? And lastly, it helps patients and those affected experience, with the cancer, with a sense of calm to be able to confront the challenges that we're facing. So we can cultivate that sense of calm over time with these practices. So thank you all so much, for listening and engaging in the practices and being here today.
Thank you. Thank you so much, Serena. Thank you, everyone, for your participation. And thank you to Cancer Wellness Center for leading the event and for partnering with Leukemia Research Foundation on this. Savina, any last few words?
Thank you, everyone, as well. And just a reminder, if you will receive an email from me with our evaluation, please take a couple of minutes to complete that and share your feedback, as well as any other topics you're interested in us exploring in the future. And if you feel like if you have other questions that come in, or if you feel like your question wasn't thoroughly answered, please feel free to reach out to either myself or Lindsay here, and we'll be happy to bring those over to Serena and then follow back up with you all individually. So thank you all for being here today and for the engaging conversation.
Yep. Thank you, everyone.